Again, the media have come up with this narrative. This narrative is there are two basic strategies that can be used with regard to coronavirus. One is you lock everything down or we're going to yell at you. And two is masking. Okay, again, I am put off by the fact that people who are promoting lockdowns right now are simultaneously saying, and again, that is Anthony Fauci, the head of the National Institute for Infectious and Allergic and Infectious Diseases, and the NIH director, both touting New York as an example of what to do. I don't know how that's possible. I really don't know how that's possible. Andrew Cuomo, he did not, the governor of New York, he did not shut down the subways until the beginning of May. Okay, he didn't clean them until the beginning of May. Even overnight, he didn't clean them. He was shipping elders with COVID back into nursing homes for months. Like, how? How is that the example of what you are doing right? Okay, so the other angle that is being used here is that masking is the be-all, end-all. Now, listen, I wear a mask. In fact, I insist that everybody in my immediate vicinity at the office wear a mask. I take this stuff very seriously. The evidence on mask wearing is mixed. Okay, let's just be frank about this. Dr. Scott Atlas at Hoover Institute from Stanford University, he has said the evidence is mixed. The CDC says the evidence is mixed. The WHO says the evidence is mixed. Now, if there is the chance that is going to lower the rates of transmission, then out of an abundance of caution, I recommend masking. Okay, so I've never been an opponent of masking. I've never thought it was a grave infringement on my liberty to ask me to mask up when I go into a highly crowded area. I've always thought, okay, seems like a cautious and well-taken step. But the notion that masking is the be-all, end-all, and this has simply become the be-all, end-all because Trump refused to mask. I mean, it really is that. Right? If Trump had not said anything, or if Trump had come out early and he had said, it's a good idea masking, this would not be an issue. But the media were looking for a point of political polarization. Now, here's the problem. The data do not back the idea that tons of Americans are wildly anti-masking. There are some Americans who are wildly anti-masking, but by and large, in the areas where there are the most cases, people are overwhelmingly masking. I pointed this out on Twitter over the weekend. People went nuts. I pointed out that if you look at the areas of the country where there are the highest levels of infection, those are also the areas where there are the highest levels of masking. Now, people on the left immediately refused to read my follow-up tweets in the thread, which pointed out that I was not saying that masks don't stop the spread of disease. I was pointing out merely that where people are seeing infections, they are masking. So the idea that people are being overwhelmingly willy-nilly stupid and just going out where there are tons of infections like in Miami and not wearing masks is really dumb. I was in Florida for a couple of weeks. People were masked up, right? As things were happening in Miami, everybody was wearing a mask. Okay, in LA, everyone wears a mask. The basic idea the media have put out there, though, is that this is just a failure of masking. Now, there are a couple of flaws in this sort of thinking. And so here is a poll. It was put out by the New York Times, and it shows by percentage how often people from different places say they wear a mask when they leave the house. And here's what it shows. In the Philippines, 92% of people say that they always wear a mask when they leave the house, always. In Mexico, which is just getting smoked right now, Mexico's numbers are awful. One of the reasons that we're seeing a spike in border counties, and there's a massive spike in border counties. Even the New York Times has been forced to now pay attention to this. Vulnerable border counties are now being overwhelmed with new cases. The reason for this is because some people are crossing the border illegally, and because if somebody crosses the border from highly hit Mexico into a border town, it spreads more easily. In the Rio Grande Valley, more than a third of families, according to the New York Times, live in poverty. Up to half the residents have no health insurance, including at least 100,000 undocumented people who often rely on under-resourced community clinics or emergency rooms for care. Places like the southernmost wedge of Texas are seeing a punishing surge in infections. Okay, so Mexico is actually a serious problem. You've seen this in Arizona as well, that Texas and Arizona are getting hard hit, particularly in the border counties. Okay, but Mexico, go back to the chart showing the masking rate. Mexico, 85% of people in Mexico say they always wear a mask when they leave the house. In Spain, which got devastated, 84% of people say they wear a mask when they leave the house. So there is this basic idea out there that masking equals really low rates of death. And then people look at Hong Kong, which, by the way, is experiencing another surge. Actually, the Hong Kong government just announced that they are going to mandate masks. It's not just voluntary anymore. They're going to mandate masks, and they're going to go back into lockdown because Hong Kong has seen a surge in cases. Now, the surge in cases in Hong Kong is like 100 cases as opposed to, 70,000 in the United States. But for Hong Kong, which never experienced a major hit, that's a pretty, like they said, basically it's spreading out of control. We can't contact trace it anymore is what they were saying over the weekend over in Hong Kong. But you can see the differential. Okay, so Spain, their death per million rate, the death per million rate in Spain, per million population is 608. Okay, which is significantly higher than that of the United States. I believe we're in the mid 400s, death per million rate. Okay, 84% of the population of Spain says they mask. 83% of the population of Hong Kong says they mask. The Hong Kong death rate is 2 per 1 million. 2. Okay, so there's a pretty wild differential there. So if you're looking at independent variables, masking doesn't seem to be the most obvious independent variable. Italy, right, where everybody got wiped out, 83% of the population says they mask. Germany, where they really didn't get very hard hit, 63% of the population says that they mask. The United States, by the way, 59% of Americans say they mask every time they go out of the house. Now, this is all self-reported, so who knows if it's true. Self-reporting social science data is usually the worst, but 59% of Americans say they always mask, as opposed to 14% who say they never mask. And now let's look at some of the other countries on this list. 4% of people in Norway say they always mask. 0%, okay, effectively 0% in Denmark, Finland, and Sweden say they mask when they go out of the house. 9% in the Netherlands, 10% in Australia, 19% in the UK, 35% in Canada. So I keep hearing Canada did this right. Canada's doing it right. Okay, but Canada's not masking. And so what's the deal? France, 54% say they mask, as opposed to 59% in the United States. And yet what we keep hearing is masking, masking, masking. Again, this is mostly because President Trump has not been so active on the masking front, right? Which again, I think out of an abundance of caution, you mask. But the very weird notion that America is not masking, like there's not a lot of data to demonstrate this. Okay, I'm looking at the map right now from the New York Times that shows how often do you wear a mask in public when you expect to be within 6 feet of another person. In all of the hotspots, the numbers are in excess of 80% of people. Well, certainly in excess of 75% of people say that they always wear a mask when they are with other people, and nearly everyone else says frequently. Very few people say rarely or never. Okay, but the narrative of the media is that there are only two things that can shut this down. Lockdown, which is never going to be a long-term solution, and masking, which most people in America are adopting. And yet the thing is still spreading. Why? Well, there are a few reasons. One, community spread never stopped. America's a very big country. And because America's a very big, very populous country, it looks a lot more in urban areas like Italy or New York than it does like Vermont. Okay, that's number one, or like Maine. Number two, the strain that's hit the United States is the European strain, not the Asian strain. So comparing what's happening in Vietnam or Hong Kong or Taiwan to what's happening in the United States is not actually accurate. It's a different strain. The Chinese virus went to Europe. There it mutated. It became about 10 times as transmissible. And that's what's been hitting the United States. Now, the good news is it seems like it was a lot less deadly than the version that was hitting Asia. The bad news is that if it's less deadly and more transmissible, you can still end up with a higher number of absolute deaths. But the way the media are pitching this is that the United States is blowing this. There's a long article in the Washington Post today about how the United States is blowing this, and apparently they say we came out too early and we didn't wear masks. Again, we are masking better than most European countries. The European countries that are masking better than we are have a higher death rate in many cases. And when it comes, these are just pure statistical facts. We are testing more than any other country by a huge margin, an enormous margin. So when we talk about the number of sheer cases being detected, President Trump would be wrong if he suggests that the tests themselves are basically the reason why we see skyrocketing cases. We see skyrocketing cases because there are skyrocketing cases. But he is right when he says that we are seeing numbers, like actual confirmed numbers, because we are doing more testing. That is true, obviously. Again, that doesn't mean that the spread is false. It just means that we are seeing the spread more clearly than a lot of other countries. We're doing more testing. We opened up at the same time as a lot of European countries. We are handling this pretty well in the hospitals. And mask wearing is generally being adopted. But the media's narrative is that we are uniquely defenseless. We blew this in a way nobody else blew this. Here was Chuck Todd yesterday suggesting the United States is uniquely defenseless against the virus. Again, I'm looking at the death rates per million. Okay, this is from Worldometers. I'm looking at death rates per million. And the death rates per million across the world, the United States is not number one. The United States currently ranks number 10 after Belgium, San Marino, Andorra, UK, Spain, Italy, Sweden, France, and Chile. And so the United States ranks number 10. Brazil is close on our heels at number 12. The Netherlands is at number 13. Mexico is close on our heels at number 16. The United States is not, in fact, uniquely defenseless against the spread. The United States is struggling with it just like pretty much everywhere else that had community spread without heavy testing and tracing at the very beginning, right? I think we should actually distinguish between nations that never got hit hard, right? They didn't have a key number of early cases and got on it early, and nations where it had already spread so widely that it was community spread before you could even do testing and tracing. Anyway, here is Chuck Todd pushing this notion that America has handled this uniquely badly when, again, the evidence does not suggest that this is true.
How did this happen? We are the richest country in human history, with an unmatched medical infrastructure and a literate, educated populace. Yet today, we stand uniquely helpless among industrialized countries in the fight against COVID-19. A world that once looked up to us to do the impossible now averts its eyes over our failure to do the possible.
Okay, again, I'm just wondering what he thinks the possible looks like when we have locked down virtually every part of the country for long periods of time, and most people are masking. The national mask mandate from the Congress, I'd like to see Nancy Pelosi promote it. Do it. I mean, let's see if we can get away with this constitutionally. Most people are adopting smart behaviors. By the way, before lockdown, people locked down. Okay, people are generally acting in self-interested fashion. The lockdowns helped slow the spread, which is what they were supposed to do. They were never the full-on answer. Okay, but this is the narrative. The narrative is that the United States has blown it in every way, except for the Democratic areas, which have done incredibly well, like New York, New Jersey, and Connecticut, which is just a joke. Okay, that is not correct. How this thing got political, as opposed to everybody is struggling with the right answers in an unprecedented time, I think it's pretty obvious that all we are seeing right now with COVID is just sort of the final iteration of a country's dissolution. It seems like that is really what is happening here. Hopefully, with the help of God, this is not, the final period of the American epic. I don't think it is. But it certainly feels that way when we can't even get our bleep together on recognizing decent intent for most people when it comes to trying to handle a global pandemic, which, by the way, is, again, rising in many areas that are not the United States. I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.